I was initially diagnosed with stage 2 breast cancer back in 2021. I did the conventional medications and treatments. So they did a lumpectomy, which is removal of the tumor in the breast, followed by radiation to the breast, chemotherapy. And then I got on tamoxifen, which was a medication to help stop and block the receptors of estrogen in the breast tissue. Less than a year after finishing all my treatments, I started having this horrible pain in my hip. And I started noticing, because I was an avid gym goer and I was doing squats and I couldn't go all the way down to the floor without hurting myself. I started to limp, and the pain was so bad that I couldn't sleep at night. The oncologist that I was working with at the time insisted that I was not anything for me to be concerned about. She told me that I did not have cancer again, and she didn't really want to do any scans, so she just sent me for an x-ray. The x-ray didn't really pick up anything. They just saw something very small, and thank God that my sister is a physician assistant, and then when she reviewed it, she called the radiologist to say, my sister has had breast cancer. Do you think that this is worth looking into? And then at that point, he said yes, and he ordered a CT scan. The CT scan, of course, revealed multiple lesions all over my femur, my pelvis, and then when they did more scans to see the extent of disease, it was pretty much everywhere: my liver, my lungs.
My heart goes out to this lady who is currently battling breast cancer and having to deal with the devastating news of her cancer spreading. I think another unfortunate thing in this history is the fact that she got the gut feeling that something wasn't right and communicated it to her doctor, who unfortunately didn't pick up the cue. Having said that, I'm glad that her sister was able to chase things up and got a CT scan done. That said, if you know anybody with a new onset of bone pain that wakes them up at night, most especially if they've got a background of breast cancer, prostate cancer, kidney cancer, thyroid cancer, or lung cancer, even if they've been told that they've beaten the cancer or the cancer is currently sleeping or in remission, please think of the possibility of the cancer coming back until proven otherwise. Now, there are some tests that they need to be doing. First, they need to be having a CT scan, and if that is not available, then they could have a bone scan. So any type of pain that wakes you up at night needs to be investigated urgently. If you found this video useful, it means other people might. Please like, share, and save for later. You might be saving someone's life without even knowing. Thank you for watching.